Hello and welcome to the BSAVA Science webinar, taking a closer look at some of the papers published in the Journal of Small Animal Practice. I'm Luisa Dormer, Scientific Editor at the BSAVA, and today I'm joined by Rachel Lumbis, Georgia Woods-Lee and Marge Chandler to discuss resources and research relating to nutrition. Rachel is a veterinary nurse with an interest in companion animal nutrition. Up until February 2020, she was a lecturer in veterinary nursing at the RVC and is now applying for a PhD on the topic of companion animal nutrition. She is a member of the WSAVA Global Nutrition Committee and was a member of the European Veterinary Nutrition Educators Group from 2013 to 2018. Rachel takes pride in helping to raise awareness of the importance of correct nutrition through veterinary and veterinary nurse education in the UK and internationally. Rachel recently co-authored the paper, Knowledge, Attitudes and Application of Nutrition Assessments by the Veterinary Healthcare Team in Small Animal Practice, which was published in the August 2020 issue of the Journal of Small Animal Practice. Georgia is the Royal Canin Weight Management Clinic nurse at the University of Liverpool Small Animal Teaching Hospital, where she deals exclusively with pets that have obesity. Georgia gained her certificate in canine and feline veterinary health nutrition in 2017 and her veterinary technician specialist in nutrition certificate in 2019, and is one of the authors of the newly launched BSAVA Guide to Nutrition. Dr. Marge Chandler is an independent consultant in small animal nutrition and internal medicine, clinical nutritionist for Vets Now Referrals Glasgow, and internal medicine specialist for Moorview Referrals in Newcastle. She has a Bachelor of Science from California State University and a Master of Science in Animal Nutrition and DVM from Colorado State University. After several years in mixed practice, she did residencies in small animal medicine and clinical nutrition at Colorado State University and Massey University. She is a diplomat of the American College of Veterinary Internal Medicine and American College of Veterinary Nutrition, member of the Australian and New Zealand College of Veterinary Scientists, Small Animal Medicine, chair of the European Pet Food Industry Scientific Advisory Committee, founding member of the European Veterinary Nutrition Educators Group, and co-chair of the WSAVA Global Nutrition Committee. Welcome to all of you, and thank you very much for joining me today to discuss this topic. So I wondered, Rachel, whether I could start with you, and I could ask you if you could outline the objectives of your paper that I mentioned was recently published in JSAP, please.
Yeah, so the main objective of the study was to assess the impact of the WSAVA Global Nutrition Committee's work in promoting nutrition as the fifth vital assessment and in enhancing knowledge of nutrition. And we had a couple of further objectives to ascertain use of existing Global Nutrition Committee nutrition assessment tools, also to identify potential new tools, and also to determine which members of the veterinary healthcare team are responsible for carrying out nutrition assessments, planning and intervention in practice.
Great, thank you. So Marge, would you be able to explain in a little bit more detail what the WSAVA Global Nutrition Committee have been doing to promote nutrition as the fifth vital assessment and what existing assessment tools are already available, please?
Thanks, Louisa. We have been doing quite a lot this past year. I just kind of looked at some of our summaries from what we have done just in the late 2020 and early 2021. I'm having trouble remembering what year it is. We've had 12 requests for the toolkit's use in articles. We try to keep track of our citations, but of course we don't always know who has cited the toolkit or not, but we have 23 that we know of from looking at that in the last 12 months. In the last 6 months, we've had 19 presentations that included the comments about the toolkit or how to use the toolkit. We had a webinar from Lisa Weef last month, the WSAVA webinar on using the pet food labels and how to understand those and some of the mythology that comes around that, and that has gone on YouTube and has over 1,600 views so far in the last month. So we're getting a pretty good outreach on that. We've got over 16,000 people that look at the Facebook stuff that we have on as well. I'm not a Facebook user, but I know that a lot of people are interacting with that. We've had comments in pet food industry, the journal, so we're which I know a lot of vets don't reach, but at least it's in the industry. So we're trying to reach as many vets as we can, mostly through publications, through social media, through the presentations that we have.
So going back to the paper, Rachel, could you tell us a little bit more about what you did and what you found, please?
Yes, so having determined the study objectives, we then devised 16 questions relating to awareness, use and also frequency of nutritional assessment. We piloted them, just made sure that they were clear and good understanding before we posted them online. We tried to ensure that the majority of the questions were multiple choice, and then there were 3 that were yes or no, just to try and encourage completion. We had, fortunately, we had the support of Clinicians Brief as WSAVA's official practice journal. They very kindly advertised the survey, and we opened it for completion by all members of the veterinary healthcare team. We had a huge response rate. The number of respondents that completed the questionnaire were included in the study, resulting in a total of 2,740 completed surveys, all of which were eligible for evaluation, which obviously we were thrilled with, but made a lot of hard work for the evaluation, but it was great to have such a huge response rate. We had probably over half, it's around 67% of respondents were vets in private practice, and the next frequently cited role was qualified veterinary nurses or technicians, and there were 18% of those. So in total, the 2 groups together comprised 85% of all respondents. We had a number of quite interesting findings. The majority of respondents identified as having responsibility in providing small animal nutrition related education or advice as part of their current role. Over half, so about 64%, recognised nutrition as the 5th vital assessment, and vets were more likely to be aware of that concept than non-veterinarians. Only 27% were aware of the WSAVA nutritional assessment guidelines, and non-vets were actually more familiar than vets, but only 4% of respondents consistently used WSAVA tools to perform a systematic nutritional assessment. And then in relation to specifically nutritional assessment, the use of any form of assessment as part of the routine assessment of the general health status was only performed by respondents just only over half of the time, and consistently obtaining a dietary history for every patient was reported in less than half of respondents. The resting energy requirement that we consider as the baseline parameter of caloric needs was consistently determined only 6.5% of the time. And around 27% of respondents reportedly always develop a nutritional feeding plan for hospitalised patients, and only 9.5% never do it. And then there was a perception that certain aspects of nutritional support, so things like establishing a normal dietary regime, calculating energy requirements and forming a nutritional plan, are only required for patients that are ill, malnourished or at risk of malnourishment, which is obviously a concern. So I think overall the results revealed that there is awareness of the concept of nutritional assessment, but consistent implementation is lacking in practice. I think there's a continued need for us to raise awareness among the veterinary healthcare team and all members of the team about the importance of meeting and providing for patients' nutritional needs. And despite having all of these freely accessible and available WSAVA tools and resources, I think knowledge and or the motivation to use them at the time appeared quite deficient. So again, those are areas that we're keen to sort of explore in more depth.
Great, thank you. So in the study then, the veterinary consultation was identified as the foremost client contact point for nutritional discussion. And I think one thing that perhaps we ought to consider and discuss in light of these findings is time constraints on consultations. So typically with the 10 to 15 minute consultation, some people may say it would limit their ability to utilise some of the resources that are available or to have detailed conversations with clients about diet. So I was wondering whether any of you have any thoughts on this, or how we could get around it if it is a problem. So, for example, could we utilise nurse clinics more often? Perhaps, Georgia, if I could come to you first for your thoughts on this, please.
Yeah, I absolutely would like to see more nurse clinics being used. I think it's always a matter of kind of space and time. You know, who has the time, where is the space within the practice, and who maybe is the right person to be speaking to that owner, and depending on, you know, what the nutritional question is. But yes, I think veterinary nurses could be used an awful lot more. They have an awful lot of knowledge often. One thing that could be really useful for practices is to nominate a nutrition champion. So that's somebody, probably a veterinary nurse within the practice, that's going to go to oversee what happens with nutrition, how these discussions happen, the systems, you know, for putting the right people in the right place.
Great, thank you. And Rachel, could I come to you next?
Yeah, I completely agree with everything that Georgia has said. I think there's a number of benefits, not only from highlighting to the public the role of the veterinary nurse and trying to sort of promote more nurse clinics from that point of view, also helping to increase owner compliance. I think actually having non-vet suggestions and recommendations can actually improve owner compliance sometimes. I think, again, particularly in relation to diet and nutrition, owners are, again, generally more likely to disclose a more detailed and accurate dietary history to veterinary nurses potentially than vets. And, you know, then overall it can sort of help to promote greater job satisfaction, respect, appreciation and recognition. Yeah, as I say, sort of helping to highlight the role of the veterinary nurse, and potentially also contributing to more time and cost-effective care as well. I think there is, as George has already alluded, I think one of the main issues is trying to sort of promote more interprofessional practice as well within the clinics, you know, and where appropriate, ensuring that actually vets are happy to kind of delegate where appropriate to veterinary nurses, and again, sort of having that dedicated space and time to be able to discuss nutrition can be difficult, but I think certainly sort of establishing that positive grounding for interprofessional work is important as well.
Great, thank you. Marge, have you got any additional thoughts on this?
I'm certainly going to back up what Rachel just said, and there is evidence that owners are a bit more candid in discussions with nurses than they are with the vets. So certainly that's vital. So there's a couple of aspects of that I'd like to discuss. One, the dietary history can be quite time consuming to get a thorough one. So either having a nurse who does that, a form that they can fill out in reception, or even, since we're becoming so much more computer dependent in the last year, sending out the form by email before they get to the clinic. I often find that owners, because I do a lot of remote work, when owners can fill out a dietary history at home, they often will put in more information than just saying, what do you feed? Then they're going to say, I feed, you know, the stuff in the blue bag, how much? It's a handful. So if they're at home, they can at least read the labels, give you a little more information. You know, the husband comes in and says, well, I give him, you know, a dental treat before bedtime and things like that we don't always get that full history when we're in the clinic. And certainly when we're pressed for time, it's really hard to get that information. And we see a lot of histories where the diet history is either a blank sheet or it's, you know, feeds such and such brand, and that's all the information we get. So that aspect of it, we do need to look at the time consumption of that. The other two vital parts of the nutritional assessment, the body condition score, the muscle condition score, and also I put weight in there. As a profession, we're very good about getting weights on our animals. We're getting better about body condition scoring. I think that's more prevalent. And that does not add time to the consult. You've already got your hands on the animal for palpation. All you need to do is just run your hands along, you know, the ribs and evaluate them for that. So body condition scores should not really take more than a few more seconds. Muscle condition scores, we're still lagging behind on that a bit for people getting those done. But again, once you're familiar with the concept, it's again just, you know, running your hands down those muscle masses and looking at the head. So it really also only takes a few more seconds. So the idea that this is a big time consumer is actually not completely true if you manage it well, like using your nurses, using online resources. And I would say just having a place on the computer, this helped our clinic quite a bit when I was at the University of Edinburgh, that asks for the body condition score and does not let you not put it in. We actually defaulted to 0 if it wasn't put in, because if it defaulted to 1, it looked like you had a lot of really emaciated patients. So having it default to 0 on those meant you haven't done this and we know.
Great points, thank you. So we've already picked up on this a little bit, but one thing that struck me when reading the paper was the question relating to who is responsible for educating clients about nutrition. And whilst the respondents identified vets as the most common source of nutrition-related education of clients, every member of the practice team was identified as having some role in providing that education. And it got me thinking that given the conversations relating to obesity and weight management, and even type of food, if we're thinking about raw feeding, for example, can be difficult conversations to have. Do you think that more needs to be done or could be done to ensure that all members of the team are confident in having those non-judgmental conversations with owners? Perhaps if I start again with Georgia, if that's okay.
Yeah, absolutely. I think more could be done. I think often having non-judgmental and confident conversations comes from the knowledge of that individual, first of all. If they are knowledgeable and are comfortable with what they are saying, then they're going to be able to have a much more meaningful conversation. It is also a real team effort, and it's what we've already touched on, that everybody has a role to play here. So the reception team can be giving really good information on maybe life stage nutrition. If it progresses from there to something a little bit more challenging, then they need to know who they can, send that owner to have a sort of more in-depth conversation about something that's a little bit more in depth potentially. So the systems need to be in place to do that. It's also probably worth trying to make nutrition important as a practice. Everything that Marge was just talking about the computer systems and training and that kind of thing. And then the time that it's taking. So each team member knows what role they play in that. So the reception team potentially getting those questionnaires out, making sure that they're coming back ready for the vet or the veterinary nurse to be then picking up all that information and building on it, talking about more lifestyle and motivation and that sort of thing. I think lastly, within the team, it's really important that there's a universal approach. So everyone is singing from the same hymn sheet. So kind of all basic training is given to all team members, and then much more specific training given to those who are going to be having those more in-depth conversations.
Great, thank you. And Rachel, I suspect you have some more to add given the findings of the study.
Yes, I completely agree. And I think that in general, I think there is definitely some lack of perceived competence and confidence and knowledge in terms of being able to educate about nutrition. And I think one of the things that we probably need to be very aware of is that provision of food is one of the primary expressions of care. And so therefore, if an owner, if the dietary choice and their decision making in relation to what they choose to feed their pet is deemed as being questioned or challenged, then it's likely to be met with some sort of hostility and potentially sort of defensive behaviour. I think the other issue is that actually there's evidence out there to suggest that an increasing number of pet owners sadly don't trust the advice of the veterinary healthcare team, and instead they're relying on alternative sources of information, often with quite questionable accuracy. They're not necessarily credible or reliable. So we need, as a veterinary healthcare team, we need to gain the trust and the cooperation of owners, and we need to be seen to be the sort of primary source of sound information, and seen to be supportive and non-judgmental. I think the way in which we can communicate, so that selecting appropriate language and empowering all members of the team to engage in those conversations will positively impact the sort of pet health and welfare, and hopefully help to also facilitate owner compliance. And I think particularly in human medicine, they've been using sort of things like motivational interviewing and exploring the language that's used in consultations, and more of the kind of psychological approach required. So I think sort of for us making sure that we're aware of how the topic is raised. You know, what sort of words we're using, so rather than fat or chubby, you know, trying to make sure that actually the you know, the approach to the consultation is appropriate, and the tone in which we kind of raise these very difficult discussions is really important. And certainly there was some really interesting findings from an alternative. We didn't, as part of this study, we didn't sort of manage to go that far into the depth of approaching these sort of these sort of subjects in terms of actual education. We just found out how many people were involved in educating about nutrition, but some interesting findings in relation to obesity and certainly weight management. There was a study last year where vets and vet students felt more blame, frustration and disgust towards obese dogs and obese owners compared to lean dogs and lean owners. There's also been you know, that obese owners of overweight dogs are perceived as causing their dogs obesity, while lean owners are thought to be responsible for their dogs being thin, or being lean rather. So I think, you know, it's just really important that we're aware of the existing research that's in this area, and you know, that everybody feels that they've been trained appropriately and therefore have the confidence and the competence to be able to instigate and conduct the conversations.
Absolutely, thank you. And Marge, I'd be really interested to hear your thoughts on this too, please.
First of all, I completely agree with everything that Rachel and George have said, and Rachel just brought up some really, really excellent points, and I'll touch on that in just a second. The dealing with the mythology and misperceptions is, you know, in every field, whether it's politics or food or anything else, is a huge problem, and I don't have any great answers for that other than I have studied this a little bit as a complete rank amateur, and one of the things they talk about is present the facts, never repeat the myth. So we just need to stay with the science, present as a science in a non-judgmental way, as Rachel said. I also want to do a shout out to Dr. Greg Takashima, who was our previous co-chair for the Global Nutrition Committee. Greg owns a clinic in Oregon near Portland that has done a fantastic job in incorporating nutrition at all levels within the practice. And I think he's a really good example of how, if the leader in the practice takes on nutrition as a serious matter, that the practice can really push that forward, because they've done such a good job with that. And Greg has published on this, and it's worth kind of looking at how he does it on a really practical level, because he's not a nutritionist, he is a general practitioner, high-level general practitioner. And the article out of Canada that Rachel mentioned too about the vet students and some of the clinicians showing some prejudice against fat dogs and overweight people. And we're not supposed to call them fat dogs, are we? Overweight dogs and overweight people. Interestingly, that doesn't seem to extend to cats. So I don't know why not. We don't seem to blame the cat owners quite as much, probably because they usually have a thin cat as well as a fat cat. That's my experience anyway. Final thing I want to mention, where I think as a profession, we're starting to become more aware of the power of communication with the client and the importance of that. I do work with a couple of really good clinicians, I won't say where, one of whom very, very smart clinician, but he doesn't talk to owners on an owner level. He talks at them. And one of the things I do when I go in there is actually listen to the owners, and that's, you know, they shouldn't be having to pay me just to listen, but because this person knows so much and wants to get it out in a hurry. And I think that is something that our profession has been guilty of, is saying, I know all of this and you should listen to me because I'm really smart and I went to school and, you know, pay attention to all these good things I'm telling you, which doesn't really necessarily land. Our last WSAVA Congress, we had a lecture by Dr. Thomas Webb, who is a human psychologist who works in motivation on changing behaviors. And he has also worked with veterinarians. He's worked with obesity and has published papers like Why Do Owners Overfeed Their Pets, and looking at exactly some of the aspects that Rachel was talking about, and how do we get owners on board with a good body weight, with vaccination, with general health care across the board, and why don't they do what we ask? He's also going to be lecturing for us at the next WSAVA Congress, because we were so overwhelmed and impressed by the information that he presented. We kind of want to, even though he's not a vet, he's a PhD psychologist, but I think that is the kind of resource that we need to start turning to, because okay, I was taught a minimal amount of communication in vet school, not very much. And we were taught how to deal with euthanasia, not obesity. And I think this is something that we aren't doing well yet, but we have so much to learn. And there was a lot of enthusiasm for Tom's talk on this, I think everybody was just amazed that there's this whole area we could be tapping into, hopefully more.
Absolutely, yeah, there have been a number of studies kind of published recently, not just in the nutrition, but looking at veterinary more widely, and about client communication with test results and that kind of thing. And then I think it's an area that, yes, we probably do need to delve into more deeply. So in the study, some of the respondents identified a need for information regarding specific and unconventional diets, such as raw and grain-free. And Georgia, as we mentioned at the beginning of this session, you have recently been working on the BSAVA Guide to Nutrition. So I wondered if you could tell us a little bit more about that resource, please.
Yes, sorry, yes, absolutely. So really the Guide to Nutrition's purpose was to assist with all these conversations, with trying to provide information in the correct way. So to give you a sort of overview, there are 4 different guides looking at raw meat-based diets, commercially manufactured diets, home-prepared cooked diets, and grain-free diets. And there is a veterinary version and an owner version of each guide. So after conversations, owners can take this information away, think about it, make some decisions based on that information. So within each guide, it will give information about each diet type and some of the advantages and disadvantages. And it's very much trying to provide this balanced view. So it's also thinking about some of the claims that are made about each specific diet type, what evidence we have for that claim, what evidence we don't have, and where further work is probably certainly needed, and also where to go for additional help with specific cases. And so the guides hopefully firstly provide education, but then they also provide an evidence-based for those balanced, supportive conversations. We can't tell an owner what to feed. All we can do is provide them with good information and hopefully allow them to make a good decision. And whatever they decide, that they can remain feeling supported by their practice. If they feel like they've been judged, that the arguments weren't balanced, that unsure in that way, then they are unlikely to create better trust, as Rachel was saying earlier. It is a big issue already. So this really was the purpose of the guide. It was to try and help with these more challenging conversations.
It sounds like a very useful resource, and actually when I read through it, I was very impressed by the balanced argument and the evidence base, or highlighting where we don't have the evidence base, was really important. So I know we mentioned this briefly earlier, or certainly Marge did, about body condition scoring and muscle condition scoring. And in the paper, in terms of individual nutrition assessment tools, body condition score was the most commonly employed tool, whereas muscle condition score was the least commonly utilised. And I just wondered whether we could explore a little bit more about why you think that might be. Are there advantages to using one over the other, or should we be using both in conjunction? Perhaps, Rachel, if I could come to you first.
Sorry, just realised that was mute. Yes, I think briefly some of, I think Marge touched on this earlier on actually, that muscle condition, I think there's sometimes with body condition, it's more accessible. It's part of the physical examination anyway. When you've got your hands on the patient already conducting a physical examination, it's quite, I guess it's easier to be able to just carry on and do a body condition score, whereas muscle condition score is sometimes perceived to be a little bit more difficult, or people are not quite so sure exactly how to go about carrying out a muscle condition score. I think they are, they're obviously completely different. Body condition score, you're assessing body fat. Muscle condition score, you're evaluating muscle mass. So it's essential that both of them are used in conjunction with one another. I think the issue is just trying to promote more confidence maybe in carrying out a muscle condition score. And again, some of the tools that we've been developing have been to try and help with that, and to try and sort of, it's difficult to sometimes explain exactly what you're doing, whereas perhaps with a body condition it's maybe easier to sort of do that and to demonstrate using videos and things like that. But we're certainly trying to sort of help make it an easier or more accessible part of the assessment, and that, you know, something that people do feel confident in using.
Thank you. And Marge, could I come to you next? Do you have any kind of further comments or thoughts on this?
Yeah, I completely agree with Rachel. I think this is a more difficult thing for practitioners to grasp how to do. And it's difficult for us to teach it remotely because it's really hard to get a good photo of. It just doesn't work pictorially, and it's kind of hard to describe when you're not there how to put your hands on. The validation behind muscle condition scoring is not as good as for the body condition scoring either. So we don't have a number system on it. Some people attempt to put a number system on it, but we have just used mild, you know, none, mild, moderate, severe, so none being normal, no muscles. And I think people are worried they're going to get it wrong. So we actually discussed many years ago, rather than having the different levels, on just saying, yes, there's loss, or no, there isn't, because of the difficulty in really assessing. My mild might be your moderate. Maybe it's severe over the temporal muscles, but okay over the shoulders. And then what do I do? So it's, I think, just getting people used to saying, yeah, there is muscle loss, and I think it's moderate. I'm just going to say that for this. And maybe somebody else would disagree, but they need to just start assessing it. The other thing, it can be particularly difficult where you have weight loss or muscle loss with a retention of fat. The classic example of this is diabetic cats, or even some of the older dogs and cats, but diabetic cats who retain their fat. Because they have muscle loss, a feline specialist friend of mine says they do a body drop. Everything just looks lower on them. And if you run your hands across their top line, they feel like a rafter. But if you put your hands on their tummy, they still have their inguinal fat pad. So this makes it kind of difficult for vets to assess, where are we with fat, where are we with muscle. I think it's a matter of just getting used to having a stab at saying, yeah, there's muscle loss, or no, I think it's okay for this breed and this individual. And it's just us continuing to say, do this. This is part of your nutritional assessment. It's important, say in some of the cancer patients, there have been studies where they have retained fat in the dogs as well with muscle loss. And that can make it hard to feel because they've got this, what they call the overcoat syndrome, a layer of fat. And you really have to get your hands in there to realize that it's fat and then not much muscle and then bone.
Thank you. And Georgia, did you want to add anything?
I have nothing to add other than to support what you've both said, really. I mean, the patients that I deal with, they all have obesity, so muscle condition scoring is difficult in most cases. We do it concurrently, so body condition scoring and muscle condition scoring. And I think, yes, it's confidence, it's promoting that this is a really important assessment to be making. I think because there's been a lot talked, and rightly so, about obesity, body condition scoring has maybe become a little bit more focused. Muscle condition scoring, it might be something that only the vet does, or that's how it's perceived, and that doesn't necessarily need to be the case. And so, yeah, I think it's just more awareness and more confidence with doing it as an assessment. And as Marge said, you know, it doesn't have to be exact to someone else's standards, but to just make the assessment in some degree is probably what's needed.
Well, I could continue this conversation all day because it's absolutely fascinating and you've all been fantastic. But I am going to stop. So thank you all so much for giving up your time today to discuss this topic. And thank you for listening. The full version of the paper, Knowledge, Attitudes and Application of Nutrition Assessments by the Veterinary Healthcare Team in Small Animal Practice, can be found in the August 2020 issue of the Journal of Small Animal Practice. The BSAVA Guide to Nutrition is available exclusively through the BSAVA Library. The WSAVA Global Nutrition Guidelines, toolkits and nutrition assessment tools are available on the WSAVA website, and a link to all of these resources can be found in the comments below the recording. Join us next time when we will be taking a closer look at another paper featured in the Journal of Small Animal Practice.